This week we're going to talk about toxins, and there are a lot more than we're going to cover in this lecture, but these are the ones that you're expected to know for the VTT and the ones you'll see most commonly in practice. For your discussion board this week, I do have you looking up some others that we don't talk about through the Pet Poison Helpline website. There is also a website for the ASPCA poison control, and both of those websites have toxicologists on staff, so if someone has their pet get into poison, you can have them call and they can tell them based on the dose and the drug or the plant or whatever it happens to be if that will be dangerous for them, if they need to seek medical care. There is a fee for this service. It's usually around $70, but they can sometimes avoid the cost of the consult with you at the veterinary clinic, so it can be worth seeing. Of course, if they called and said, hey, my pet's having seizures, you wouldn't say, go ahead and call the ASPCA poison control. But if we're not sure if something is toxic, it can be a good route to go. The other advantage of using these services like the poison control and pet poison helpline are that if the pet does come in and they're sick, their veterinarians will consult with our veterinarians and let them know what the most current treatment recommendations are and what they know to be effective or ineffective against that toxin. And they'll do that as many times as you need to with just that one fee that the client has paid. They also keep really extensive databases about sometimes products that don't have the active ingredient listed. So this is a resource that we all need to be aware is out there, these two different services, and we should all use for these cases or anytime we have a question. When the patient comes in, we'll need to get our normal brief history questions and TPR as part of triage, but what other information might we need for something where we suspect a toxin is at play? I always think of the 5 W's. Did you guys learn this in school? I feel like this is an elementary school thing when you're learning to write a paper. What is it? It's who, what, when, where, and how? Okay, yeah, I'm having a distant memory about how this works here. So we want to know what the toxin was, right? So what the name of the medication is. We need to know the strength, a number of tablets, and a lot of the time they're not going to know, oh yeah, my dog took 2 ibuprofen, but what they might know is that this bottle contained 100 count, okay, and I opened it last week, so maybe I've taken 8 since then. Maybe they have lots of headaches, I don't know. So the maximum that the pet could have eaten is 92, and I found 50 on the floor. So now that takes our maximum to 42, and each tablet was, 200 milligrams, let's say. So sometimes we can use deductive reasoning. We've also had people come in because they think their pet's gotten into something and they have a list of different medications. They may not even know which one it is or if it's a medication at all, but we can take that information and we can report the signs to poison control and we can give them the list and they can absolutely help us narrow it down. So when, again, we may have a window. This may be, okay, the client left for work at 8 a.m. and they returned at 5 p.m., so somewhere in this span. This can be relevant because most drugs, of course, have an onset time. So if they haven't shown signs within 4 hours, then maybe they didn't actually get into it. If they haven't, what was I going to say? If they haven't shown specific signs within, an hour, maybe it is that they didn't get a lethal dose. So this is a relevant question for us as well. Where? So where in the house were they? Okay, could they have eaten part of the bottle? Could you be missing some pills? Could some of those be under the couch or something? Really helpful to just verify with clients this information because sometimes they'll say, oh yeah, I don't know, he was in the other room and I don't think he really ate it, but these are the signs that I'm seeing and actually you have something totally different. So it's worth asking about, and that kind of goes along with how did he consume it. A lot of the time we see that patients actually receive these medications from their owner, and this is particularly true for cats. It's not that cats just eat pills that are dropped. That's very rare, but what clients will do is give their cat human medication thinking, oh, he's got a limp, let me give him Tylenol for a few days, and we'll poison their cat inadvertently. So how did he come in contact with it? So maybe my 5 W's isn't perfect, but I think it's a good place to start for these. Before we talk about specific toxins, I want to talk about treatment modalities. So these are different treatment options. Which treatment option is going to be effective against which toxin? Well, we're going to figure that out as we go here. But sometimes this information changes. So for a long time, for instance, we thought that giving charcoal might be an effective treatment against marijuana toxicity. Well, it turns out it's not. Now, some doctors still do it, but if you talk to poison control at this point, they may not recommend you give it anymore because now we know it's not effective. So it's helpful to know our menu of options here for toxin treatment and know that sometimes this information changes as we learn more. So decontamination is always the top priority. This is always the best option. It's going to be effective for just about any toxin, and it just means getting it out of there. Now, there are different routes of decontamination. We might think about things like inducing vomiting, and we'll go over that, but that's not the only way. So if it's a topical toxin, our topical flea medication is a good example. Last week for our triage cases, we had an example of a cat, Rintu, who had flea medication put on him that he had a reaction to. In those situations, we want to lather, rinse, and repeat. We want to use dish soap or hand soap, something that's powerful, and get that off of there. Most of the time, those are insecticides, or it could even be something like a cat that we know came in contact with a lily plant, but don't underestimate bathing. We want to get stuff out. Of course, we see this too with our Colorado River toads, our toxic toads. When they come in contact with those, we'll rinse them out. That's going to be the number one priority. If we can get rid of the toxin, we don't need to worry about it. We'll look at emesis here in a second. It's notable, though, for all these decontamination methods that these are time sensitive. So we may not want to have the patient wait in the exam room. We may want to initiate this treatment as soon as they come in the door. And obviously you can just touch base with the doctor on that. Hey, I have a dog that ate chocolate. Him waiting in that exam room for half an hour is going to make a difference in how much he can absorb. So we may want to at least bring him back and induce vomiting, even if the doctor can't talk to the client right at that moment. Now, enema is another option. Some drugs continue to be absorbed. Marijuana, again, is a good example as it goes through the colon. So in that case, it may be appropriate to continue to give enemas to reduce the amount that's in the circulatory system. I want you to watch the video on gastric lavage. We have a case involving bread dough that I've included for you in the playlist. And gastric lavage is us passing an orogastric tube. The patient needs to be sedated or ideally fully anesthetized to do this. And then we pump fluid in to be able to remove fluid and food and the toxin and whatever might be ingested. This is a technician skill. This is something we perform, and I usually have you practice during the course of this class so that we can feel adept at that. But if the patient, let's say, is so comatose from the drug they've ingested that they can't vomit safely on their own, this is an option. Sometimes you have patients that have such distended stomachs that even if we induce vomiting, their stomach can't fully contract. So this is a good option for those guys. And then urinary catheterization. So some things like chocolate and caffeine will continue to be absorbed to a degree if they're allowed to be retained in the urinary bladder. So for that reason, urinary catheterization can be helpful, and it can also be helpful to keep track of what urine is produced if we're concerned about the function of the kidneys. So how can we induce emesis? Hydrogen peroxide is the old standby. Sometimes doctors would mix this with salt. There's no specific dosing. You simply get some tablespoons of salt and hydrogen peroxide and force it down the patient's throat and hope that it makes them nauseous, especially because of that foaming action. This can be harmful if it gets in the eyes. Salt can be harmful because it disrupts the balance of salt in their body, of sodium, and that can be dangerous. And it's not always effective. On top of that, us wasting time, this was not real fun, by the way. You would stand outside in the yard and try to give hydrogen peroxide to an animal that doesn't want it, by the way. But on top of that, the new studies tell us that it can harm the esophagus. So it can cause ulceration of the esophagus, and that can lead to holes in the esophagus from this irritation. So for all of those reasons, this is not recommended anymore if we have other options. So if I'm in the middle of nowhere or the client can't come in, okay, the doctor may recommend trying this as an option, but But in general, we have more effective means, and it's usually better to have the client come in immediately for us to give an injection than to, say, waste an hour trying to get the pet to vomit with hydrogen peroxide at home. Now, the most commonly used drug for emesis for dogs is going to be apomorphine. And this is not a controlled substance. This is not morphine. It's chemically related, but it binds to the dopamine receptor. Okay? And it's an agonist since it binds to that receptor and immediately will cause the patient to vomit. You can give this IV, and I've had many situations where I'm giving it IV, and even though I'm pushing it quickly and it's a small volume, the patient actually starts to get nauseated or retch as I'm giving it. So it works very fast. Downside here is that the patient does become sedate. Now, this can be kind of helpful if the patient's pretty crazy, especially, let's say, if he's eaten something like chocolate, which has made him hyperactive, but it could be concerning or problematic if you have a patient that's already sedate from what they've taken. So in that case, we might avoid this drug. Now, after we give it, we do want to reverse it, or at least give something that's an antiemetic, especially if we plan to give something like charcoal. Okay, I would not want to make my patient throw up and then give them a large volume of something in their stomach. That would be really unpleasant. So we may follow it up with an antiemetic. Cerenia is meropenem, or Zofran is ondansetron. Or if we want to fully reverse the drug, we can use dopamine receptor antagonists. Metoclopramide is one of those, and this will remove the effects entirely, but it also potentially can slow GI motility. And at this point, if the patient has eaten something toxic, we want the GI system to move it through fast, so we may not do that. Naloxone is technically a mu receptor antagonist, but it will be somewhat effective against apomorphine too. So that's another option if we give it and our patient is way too sedate. So this is a very common drug to give. Xylazine can be used in cats, and xylazine is an alpha-2 agonist, and alpha-2 agonists are also drugs that are sedative. Dexdomitor, you've probably heard of that one, is an alpha-2 agonist. Okay. So cats will often vomit with these, but it's not as reliable as giving apomorphine to dogs. As I said, the sedation effects can also be concerning, so typically we will reverse xylazine or dexdomitor with one of these antagonists. So block the receptor once we've gotten the effect that we want. And anytime we give an antiemetic, we need to monitor them really closely. So this is not, I'm leaving a dog or cat in a kennel and walking away, for a couple of reasons. One, with the sedative effects, they may not be able to clear their airway properly. They could aspirate, and that would be my fault. I've had dogs vomit up whole washcloths and have them kind of get stuck in their esophagus and need help pulling it out, or they would choke and die. And then the other big one is a lot of dogs will immediately eat whatever they vomited up, so that's going to be relatively counterproductive. You also want to try to quantify what you have here. So we can do that by weighing it. You can do it by putting potty pads down. I've seen people, kind of get them to aim into litter boxes, and then you can weigh the litter box on a gram scale after they vomit, empty it, weigh an empty litter box, and then deduct the two. But we do want to make some note of what's in there and quantify in some way, either estimate or weigh the vomitus. One reminder here, sometimes pets do vomit things that are a little embarrassing for the client. I've heard lots of stories about, condoms and different things that maybe aren't something that the client wants to share with everybody. I know my worst incident involving this was a pet who had eaten some underwear, and the client didn't want to have an endoscopic procedure done, so we told her, there's risks, but we can try to give him an emetic drug, and he may vomit it up. We'll hopefully help him so he doesn't choke, and hopefully you'll avoid having to do like a foreign body surgery. So it was a fairly large woman, and I was happy. I took the dog back. I gave him apomorphine. The underwear came right up, and I put them in a Ziploc bag, and I ran right out to the lobby with these large pair of underwear, and I was all excited that the dog wasn't going to need surgery and he was fine and everything looked good. And so I ran up to the woman and said, "Look, we got them out." And behind me I see a client service representative kind of waving her arms madly at me, and that was the moment I connected that maybe I shouldn't bring a stranger's underwear into the lobby and show it to a group of other people that were waiting as well. But yeah, so we can induce vomiting for things like that. It's just that there is a chance that they could choke on it, we could tear the esophagus, we could cause unproductive retching. So if we do that, there's a risk to it, and typically we'll inform clients of that before we start, or someone should, either you or the doctor, that there are risks. We're going to do everything we can, stand there and monitor to make sure that it's safe, but there's a chance he could aspirate or harm his esophagus in the process. Probably heard of using charcoal to bind to toxins. Charcoal is what we call an adsorbent, adsorbent. If you look up the definition of an adsorbent, it's something that absorbs toxins, which I think is very strange. But specifically, it binds to that toxin and keeps it from going from the GI tract to the bloodstream. And so these substances are bound to charcoal, can't do any harm to the kidneys or liver or wherever they go. Now, this only works for certain kinds of substances, and again, we kind of used to give it for every toxin, but over the years, through trial and error and new chemistry, we're learning which toxins it may actually bind to. So sometimes we're giving it, and we're not sure if it's going to do anything, but it's not going to hurt. Oftentimes, charcoal contains sorbitol, and sorbitol is a cathartic. Cathartic's another word for laxative. How would a laxative be helpful in this situation? Well, even if, let's say, the charcoal doesn't bind well to the drug or doesn't get at all, if we have a laxative in the system, everything's going to move through the GI tract much quicker. And so hopefully that drug will have less time to get into the bloodstream. We can use an orogastric or nasogastric tube to give this if we have a large volume to give and the patient is comatose or not alert enough to swallow. I've also done this for patients that were very, very aggressive, that we couldn't give a large amount of charcoal to safely. You can sedate them and pass a tube to be able to give it. Mixing the charcoal with food does not reduce how effective it is. So sometimes you get really lucky and patients will just eat it if you mix it with a little canned food. You do want to check with your doctor. Some doctors believe that it does reduce the efficacy, but poison control says that it does not. And then we need to be careful not to cause vomiting. If you're giving it and the patient looks nauseous, you need to stop and tell the doctor, right? We're patient advocates. We don't just do it because it's written down. If the patient looks like he's going to puke, okay, that's not going to be helpful, and he could aspirate the charcoal. Especially keep this in mind if we've just given an emetic. We probably can't give the charcoal right away. You might need to wait 15 minutes. It might be longer, depending on how that patient looks. So use your judgment. You are not a robot. So this would be the ideal situation with charcoal, that they just go ahead and take it on their own. Dogs cannot drink through straws. I feel like somebody's making a face right now, surprised that dogs can. They can't, okay, but we hope they could. That would be nice. A lot of the time when I give charcoal, I do something like this, where I put a potty pad on the pet, kind of cut a hole in the middle for a bib, and I'll also put one on myself because it gets everywhere. It's helpful to have an assistant, and then we're going to tilt the head back a little and put it just in the corner of the mouth. But if we do this too fast, if we tilt the head back too far, your patient will choke. We are not waterboarding them. This is not going to be something where we have to do this super fast. We need to go slowly. Unfortunately, you see a lot of the time technicians will have 100 mils that they need to give, and they'll do it so quickly that 50 mils end up on the fur, but they'll be like, okay, well, I did my job. My charcoal's gone. No, you didn't do your job, and that's not cool. So take your time, okay, use your judgment. Diuresis is another real common term that you'll see for treating toxins. And diuresis is giving more fluids than needed for hydration. So we're not doing diuresis to a patient that's dehydrated. Okay, that would just be fluid resuscitation, right? So what we're doing here is we're giving fluids to help increase the rate of filtration for drugs or toxins that are in the system. Basically, just like our GI tract, if we give a laxative, it speeds the transit time of that drug through the GI tract, hopefully doesn't have a chance to absorb. The same thing is true here. If we increase the speed at which fluid filters through the kidneys, there's less time for those drugs to do any harm, especially for drugs that normally do harm the kidneys. So we'll increase the rate of excretion. And the other effect that we have here is very important for the kidneys. So the kidneys have something called the glomerular filtration rate. And if you remember to A&P, you took it at some point in career prep or VA or vet tech, the glomerulus is the tuft of capillaries that comes into the kidneys, and then the nephron this little tuft of capillaries squeezes out the filtrate, so the water and proteins and drugs and everything, and it goes down the nephron and out, and eventually, okay, out to the bladder, or down here, down my ureter and out to the bladder. So here's my little nephron, my loop of Henle, and here's my glomerulus. Well, when we give more fluid, we put more fluid in the system, specifically IV fluid, this effect is not as pronounced with just oral water or sub-Q fluid, because those things kind of hang out in the tissues or the GI tract. IV fluid, though it's forced to be in my blood supply here, well, then this rate is going to go faster. Okay, we see an increase in glomerular filtration rate when we have an increase in fluid in the system, specifically IV fluid. Okay, so this goes faster. Well, why do we care? Why else would that be helpful besides speeding the excretion of drugs? Remember that after the blood drops off, the serum, plasma, all this stuff to the nephron here, the blood cells that contain oxygen continue on and they wrap around the nephron. And those blood cells, what do? They deliver oxygen to the actual nephron, the main part of the kidneys itself. So that means if we increase glomerular filtration rate, we increase perfusion to kidneys. So if we are dealing with a toxin that potentially harms the kidneys, by getting blood to them faster and oxygen to them faster, hopefully we can minimize that damage and they can protect themselves or prevent themselves from being harmed. So again, IV fluids are really required for good diuresis. Sub-Q fluids will be a little helpful, but it's not going to change my glomerular filtration rate much. Same thing with oral water. We can also sometimes even use diuretic drugs to move things along if we want to. But the hard part about this for us as technicians, and what's really important to know, is because we're giving more fluids than the patient needs for hydration, it's very easy for them to become overhydrated. So that's where measuring our ins and outs is really important, and that's what I have you doing on your lab this week. If we get overhydrated, we can end up with fluids in places like our brain and our lungs, and of course that can be deadly. So we really need to know how much is going in and make sure that an equivalent amount is coming out for diuresis. Now for the liver, we don't have any specific way of repairing or protecting the liver outside of these liver support supplements that are antioxidants and anti-inflammatory for the cells of the liver. And in neither case do we really understand how they work, but we know they do seem to be helpful. So we'll typically choose one or the other if the patient's ingested something that is potentially hepatotoxic, and hopefully that will help the liver either protect or repair itself. So milk thistle has been known for centuries to be protective for the liver. And the one that we have more commonly in practice is S-adenosylmethionine, or SAMe. The trade name is Denamarin. And we can start the patient on that when they're hospitalized or when they first come in with a liver toxin. And then we usually will keep them on it for a few weeks and maybe recheck liver values and see if we have any issue. It's not going to hurt them if they don't need it, but it might help protect their liver. Intralipid emulsion is a fairly new therapy that works in a similar way as the charcoal, where it binds to certain kinds of drugs or toxins, except it does that through the intravenous administration route instead of the GI tract like charcoal does. Intralipid emulsion is literally fat. So it says on the bag 20% fat. It's sort of like ranch dressing, basically. You give this IV, and those fats bind to the drugs that would normally bind to drugs in your system, and then the body metabolizes these lipids out. So you quickly excrete them so that they're not allowing the drug to be absorbed. So if we know we have a drug that's lipid bound, this is a very, very effective treatment to give a small amount IV, and then it doesn't move into our bloodstream. Now, one of the examples here would be pentobarbital. Pentobarbital is euthanasia solution, and from time to time we have somebody euthanize their cat, and they go home and they bury it, and then their dog digs it up and eats it, and that pentobarbital actually gets into the muscle tissue and will get into the dog that way. So the dog comes in not dead but very sedate from pentobarbital. Remember, pentobarbital used to be an anesthetic too, so if we don't give enough to kill them, they just end up kind of anesthetized. So the dog will come in looking very sedate, and we can give this intralipid emulsion IV, and quickly that drug will bind to the fat, and the fat will be excreted from their bodies. With this, we do have to watch out that they don't end up with too much fat in their blood, so we'll often draw their blood and look for lipemia, look and see if their blood is getting too fatty. But this is a cool treatment because it's very cheap. These bags are inexpensive. If you can give IV fluids, you can give intralipid emulsions, and so sometimes we just use it if we're not sure what the patient has gotten into or nothing else is working. It's not going to hurt to try it. I should say I've included a video in the playlist of a puppy who got an ivermectin toxicity. Ivermectin, of course, is a dewormer. It's the active ingredient in most heartworm medications. And some pets, even if they get a normal dose, are sensitive to it and develop a toxicity. So that puppy had an ivermectin toxicity, and they used the intralipid emulsion because ivermectin is known to bind to fat. And they saw a pretty dramatic improvement. So make sure you take a look at that. Now, one of the other therapies we sometimes need is ventilation. Ventilation might be used in situations where the patient is either so sedate or the muscles have relaxed to such a degree that they can't breathe well on their own. Real common toxicity we see is baclofen. Baclofen is a drug that people take for muscle spasms and back pain. That's how I remember baclofen, back pain. But pets will eat it, and it will eventually relax all their muscles, including the muscles of their diaphragm and those intercostal muscles that help with breathing. So sometimes pets will need help on a ventilator for a few days to be able to breathe on their own until they can clear that toxin from their system. This, as you can imagine, is very, very expensive. It requires a dedicated technician, and the outcome is certainly not guaranteed. You can see how many different pumps and drugs this patient is attached to, in addition to the breathing tubing and the monitoring. So not something that we do often, but is something that we do from time to time in critical care for these types of toxicities. Sometimes we get really lucky and our drugs have specific antidotes. I do have you putting in your nerd books for next week. There's a table in your textbook that includes some toxins that have specific antidotes. One that we'll talk about here is acetaminophen. Okay, and, oh God, I can't spell today, and acetylcysteine. Okay, acetylcysteine is a drug that we can give that counteracts the effects of Tylenol, of acetaminophen. And so if we know the patient's gotten into it, we can give it and really minimize the harm. So sometimes we have drugs like that that block the formation of the toxic products or even bind to the drug and help remove it. Sometimes we have true reversal agents. So we talked about naloxone as a opioid receptor antagonist. Well, let's say the pet gets into something like fentanyl. That's a mu-opioid agonist, so I can block the effects with naloxone. So that's a helpful approach. And then we also have anti-venom. And I've included a really cool video in the playlist for you about how anti-venom is made. Anti-venom actually is antibodies from an animal that's been exposed to the venom of a snake or a scorpion or whatever we have that anti-venom for. So in the video, they're injecting horses with scorpion venom, and eventually the horses are going to make antibodies against that scorpion venom. And then when another patient gets bitten by a scorpion or bitten by a snake, whatever kind of anti-venom we have, those antibodies, we've got the venom here, okay, they will go ahead and they'll bind to the venom and allow the body to neutralize it faster. Antibodies are kind of crazy like that. Your body doesn't care that you didn't make those antibodies. The antibodies just do their job. So they find the venom and they block it out, and then it's not going to be able to be active in your body. So that's all anti-venom is. At this point, it's all made by injecting some animal or sometimes a person. You can give, let's say, a plasma transfusion if you've been bitten by a venomous snake to another person, and your plasma will have antibodies against that venom. But all of that stuff is natural, it's not synthetic, and it will bind and hopefully neutralize that venom. So when we have specific antidotes available, that's always going to be the best course of treatment for any toxin. So let's look at these environmental hazards first. We're kind of lucky in Arizona because we have a lot of these to learn about, or a lot that we see on a regular basis. So fun stuff for us. So envenomation is a big one from rattlesnakes specifically. And I want to just clear up some myths and so forth about this. I don't care what kind of snake bit your pet. It would be great if we had a shelf in the back that had, specifically diamondback antivenom, but we don't have that. What we have is antivenom that contains antibodies that were made against lots of different kinds of snake venom. And if we did have precise knowledge of what kind of snake, and we did have that choice, that would be more effective. So sometimes clinics here in the Southwest will buy antivenom that's made from snakes whose venom has been injected, specifically snakes from the Southwest, and that will be more effective than if I buy a product where it's snakes from all over the country. But otherwise, I really don't care what snake bit your pet. How much they get as far as the dose goes of how much they get in terms of the bite and the amount of venom varies a lot. I've heard a lot about, in springtime, the babies, they release more. We don't know any of that for certain. You can get what they call a dry bite where we don't get much venom at all, but again, we don't know, and we're not going to treat the patient based on those guesses. Now, the location of the bite tends to vary depending on the species. So dogs tend to get bitten in the face because they're down and they're curious or they're barking. Cats, the majority of the time, either get bitten in the back of the leg as they're running away, because I think they're smarter than the dogs, or they get bitten in the paw, that front paw, where maybe they do the thwap, 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 right, to the snake. They're trying to kill it. Horses, cows, they can be bitten in the face, but more often they're just bitten in the leg as they're walking around and trot upon the snake and kind of don't know that it's there. Now, the most immediate sign we see is swelling, and this is not like the swelling we see with an allergic reaction. It's very painful swelling. Okay, very, very painful. It can make it difficult to restrain them or clean them up. And usually it's asymmetric swelling. So it'll be one side of the face, at least initially, where the bite is, which again is different from what we saw with allergic reactions. Oftentimes we will see bleeding. You may be able to actually see the punctures, but sometimes they're hidden underneath the tongue or somewhere that it's not immediately obvious. Now, some pets do have a true anaphylactic reaction, and oftentimes those pets don't survive. Their signs will be very severe, but otherwise we mainly see that the venom affects the hematologic system. Okay, that's going to be the primary influence or the primary concern that we have here. It can affect the heart and it can affect the brain, but primarily it's going to affect the blood in a negative way. The initial signs we see go along with being very painful, so tachycardia, dilated pupils, sometimes hypersalivation, and we can also start to see bruising, that petechiation or that pinpoint hemorrhage, in addition to the bleeding from the wounds themselves. Here's some examples of these guys after snake bite to the face. You can actually see on this guy down there here that he's got some bleeding, and they've chosen not to clean it off, which oftentimes we do because it is just so very painful to handle the tissues there for them. All of these would be, within a few hours or a day after the actual bite. Since we do see at this point the swelling is fairly symmetrical, but again, initially it'll just be in the location of the bite when they first come in there. You can see these guys are going to be pretty uncomfortable, and we do worry about their airways. It is possible for that to be kind of an issue for them if the swelling extends, but for the most part, not too bad. You may, though, a very good idea to take off things like collars just in case. Now, how do we know the pet's had a snake bite? Well, we said bleeding, potentially being able to see the puncture wound, asymmetric, painful swelling. But the other thing we can do is we can look at the blood, and we want to do this with a fresh sample. We don't want to put this in a tube. And what we're looking for is the venom has started to affect the red blood cells. And what it does is it kills these red blood cells, and it does this by kind of dehydrating them, and they get spiky like this. So this is an example of echinocytes. And if you've taken other classes, you've probably heard this term before, because we also see echinocytes if blood is just allowed to sit in a tube for a period of time. Sometimes they just call this crenation. And it just means that the cells have started to dehydrate and die. So if I look under a microscope and see this, that's probably why. But I shouldn't see that in a patient that has just had his blood drawn and I've immediately made that blood smear. So that's what I would want to do to check and see if they have venom in their system. This is a pretty helpful way to go about it. So what do we do for treatment? Well, pain medication, of course, is something we want to focus on. We'll give this right away, but far and away the most important treatment is antivenom. We said anytime we have an antidote, it's the most valuable thing that we can do. So the antivenom, as we said, is going to bind to the venom and keep it from being active in the body, and that's helpful because otherwise we see that the venom continues to destroy red blood cells and also interferes with clotting. So we get a hypocoagulable state. And we saw last week with disseminated intravascular coagulation that if we can't clot our blood, we can get bleeding in places like our brain or our lungs or places that will cause us to die. So we don't want to be in that hypocoagulable state. Now, how much venom do we give? Well, it's not a calculation based on the patient's weight. It really is a calculation based on how much venom they received in the first place. And we never know what the answer to that is. So typically we want to give as much antivenom as we can until the patient is no longer showing signs of continued swelling and bleeding. Now, unfortunately, antivenom is very expensive, so typically we'll just give as much as the client can afford. That might be we give one bottle, and if we really need to give another, we call them and ask because it'll be $1,000 a bottle kind of a thing. But ideally, we would give it until the swelling stops and the bleeding stops, so we know we've counteracted all of it. Fluids are nice, especially if you have a patient that's not going to be eating and drinking for a while. And if we do have, enough blood loss, a blood transfusion can be helpful. But remember, if the venom's still in their system, all the venom's going to do is destroy the new blood that you put in there. So that's not something we do very often. The money's better spent on antivenom. Antibiotics are not helpful, and steroids are not helpful. So if you see those given, you're probably in a setting where they're not using current treatment protocols, and that's a little concerning. Scorpion sting. So scorpions, of course, we have many different kinds here. Most of the time we see this happen at night. It'll be a little dog that goes out the doggy door to potty before bed, and he comes back in kind of limping. Cats, again, this tends to be front paw, where they just go ahead and they hit it with their paw. Most of the time we don't see any serious side effects from this. So if the client calls and says they just saw their pet stung by a scorpion, it's usually fine to tell them just to take a look, to monitor it, that we'll just keep an eye on it. There's not necessarily anything specific we need to do here. So the pet will react as if they're lame on the limb or painful. People report like a tingling, but when you palpate the limb, there will not be typically a response. So it's kind of weird because they act like they don't want to walk on it, but if I pick up and squeeze that paw, they don't care. We'll also see sometimes they're just restless and anxious, a little bit of drooling or coughing. Cats are more likely to develop neurologic signs, so they may even have some facial twitching. I know my cat got stung a while back, and she just ran around the house like crazy, like she had the kitty zoomies for about an hour, and then she was totally fine. It's very, very rare to see any kind of redness or swelling or hole where the bite was. So if you're seeing that, it's a lot more likely that they were bitten by something else, and that would be something we may need to treat. So just keep that in mind. Now, I mentioned there is scorpion antivenom, and that video talks about it, but this is not something we have available in veterinary medicine. It's still many thousands of dollars in human medicine, and it's very rarely needed. If the patient does have a true anaphylactic reaction, we'll treat that with the drugs we talked about last week, like epinephrine. But otherwise, we usually do supportive things. So some doctors will give just analgesic medication, pain medication. I've seen doctors give steroids. I don't know that there's really good evidence for steroids, but in any case, we'll just make them more comfortable, and usually these signs peak within about 6 hours and then go away. Now, spider bites are a little bit more potentially concerning. Black widows, for the most part, are not a big issue. Black widows are orb weavers. They hang out in corners. They will not attack your dog unless you run through a nest or something. It's not going to be an issue. So just because you saw a black widow doesn't mean anything bad is happening. I have some that live outside my house and have at many places I've lived, and Never really had an issue with these, so we're not super worried about these. But brown recluse, these are ground-dwelling spiders, and they kind of run around at night, and they will like jump up and bite your dog. They're pretty scary spiders. I'll see if I can find a good video in the playlist for this. But the main concern with spider bites is tissue necrosis. So once the spider's bitten, over a period of days or sometimes weeks, the tissue will die in a larger and larger area. Unfortunately, once this happens, there's no way we know of to prevent it. Sometimes we'll have surgical procedures where we excise a certain amount of the tissue, but usually that necrosis continues to spread. So no specific treatment here other than monitoring and wound management. So here's an example of, this would have started as a teeny tiny bite and grew, and eventually they would have debrided that wound, and we can do other things like, bandage, or use, our honey bandages, or wound vac therapy that we've talked about in some classes to help this heal, antibiotics to keep it from being infected, but otherwise there's probably not a lot else we can do. I've seen some really sad cases. One in particular was a Shar-Pei, and I was there when they saw it happen and brought him in, and he just had a little spot on his chest, but over a period of weeks that spot spread, and he had multiple surgeries, and eventually a very large open wound on his chest that became infected, and he did die of sepsis. So again, not a lot of treatment here that we can do other than keep an eye on things and manage the wound. Next, we've got our bufo toad, or Colorado river toads, and these guys are present in Arizona and across the Southwest. They tend to come out when it rains, and compared to other toads, I find them to be relatively fearless. I think they know that they're toxic, so they do not run away. They're not scared of dogs. They won't go and hide, and I think that's why dogs come in contact with them a fair amount here. So dogs will see them, they'll kind of walk up to them and lick them. I've included some videos where that happens, and then they'll start to drool and shake their heads because the toxin immediately will cause them to have kind of a numb, weird sensation in the mouth. So we'll see that hypersalivation, and that might even be facial twitching. If they lick the toad enough, if they don't get the message immediately, or if they ingest a dead toad, I've never seen anybody kill and eat one, but sometimes there's a dead, dried out one out there, they can have seizures and even cardiac arrhythmias. So if the pet has just licked the toad and is just having that salivation and facial twitching, what we want to tell the clients to do is wash the mouth out at home for 10 minutes. And you can do this in the yard with the hose for a big dog, small dog in the sink, but we want to make sure that the head is pointing down so we don't have the pet, drinking the water or getting into their lungs while they do this. So 10 minutes. If the pet's still having signs, they can bring them in, and that's the first thing we'll do too, is wash them out. If the pet's having full-on seizures, okay, we may need to have them come in and get anti-seizure medications like Valium. I wouldn't ask them to wash the mouth out at home if we're seeing seizures at that point. And then from there, we would just give medications to control the seizures. In the cases that I've seen where they've eaten a dead toad, we have had to admit them to the hospital, and in addition to seizure medication, give anti-arrhythmic drugs. But again, that's pretty rare. Usually just washing the mouth out is sufficient, and it'll be relatively self-limiting. Lilies are a plant that most people know is toxic to cats, and unfortunately they're in just about every supermarket bouquet. Not every plant that looks like a lily is truly a lily, so if you have someone bring a pet in and they're concerned about it, if they have a photo of the flower, you can always send that to poison control and they can tell you for sure. But we see this most around Easter, and cats don't have to do a whole lot. They don't have to eat the plant. If they brush up against the plant and come in contact with the pollen, that will be sufficient when they groom themselves to be toxic for them. And unfortunately, usually we don't know that it's happened until they experience acute renal failure, so the kidneys stop working all of a sudden. Now, the kinds of signs we'll see with kidney failure in general are vomiting and not feeling so hot. They're very vague signs, so if the client doesn't act right away, that kidney failure is going to get worse and worse. Occasionally we're lucky, and when they first eat the plant, they eat a lot of it, we'll see that they're drooling and foaming, and we might be able to do some decontamination, like inducing emesis or giving charcoal, but almost always we don't see these pets in until they're in renal failure. And then it's not so much a matter of treating the toxin as it is of helping to preserve kidney function. So that's where IV fluid therapy and dialysis come into play potentially. Dialysis, I've included a few videos. There's different techniques out there to do this to help kitty cats, but they even have things out there like kidney transplants. Dialysis and kidney transplants are out of the reach of most clients financially, so usually if we have an injury to the kidneys like this, we just keep them on IV fluids, very aggressive diuresis therapy, okay, for a period of days, and hope that the kidneys with that help can recover sufficiently. So we'll recheck those renal values. There's no other specific antidote or treatment that we can use here that's effective. Oleander is a plant that's used for landscaping. You see it in lots and lots of parking lots here in Arizona. And it's a plant that, if ingested in large amounts, can affect the cardiac system. So it's a cardiotoxin. And we'll see signs like tachycardia. We can also see arrhythmias. If you're familiar with any of these arrhythmias from other classes, an AV block is one of the common ones that comes up with these guys. We can see disruptions in the level of potassium. That would be hyperkalemia, K for potassium, along with effects on the neurologic system, and they can definitely die. So if a pet eats a large amount of this, we immediately need to induce vomiting, okay, decontamination. And from there, we'll keep them in the hospital and monitor their electrolytes, monitor their heart rhythm, and be ready to intervene with drugs to address those things. There are actually antidotes out there that are specialized antiarrhythmic drugs that can be given if the pet has a severe case of oleander toxicity, but that's a very expensive route to go. Now, there was a pretty famous story in Tucson maybe 5 years ago, might have been a little bit longer, where a volunteer at the zoo took a bunch of hedge trimmings from around the property and gave them to the giraffes, and they happened to contain oleander, and I think 3 giraffes died. So this is definitely potentially a deadly toxin. Now, the nice part is most of the time people will just bring these guys in because the ball rolled under the oleander bush and the dog got the ball, and they're super concerned about it. Dogs don't usually just eat bushes, but let's say it's near a barbecue and some grease got onto the plant, then we might have some issues. Another one we're lucky enough to have in Arizona is sago palm, and again, most of the time dogs don't just eat plants. Cats even more rarely. We'd see these same effects in cats that we're describing in dogs. It's just that cats are not usually as stupid. So specifically, there are pods with these plants that if they eat the bean pods can be very dangerous, and this is going to primarily affect the liver. So the liver is responsible for things like making your clotting proteins, right? Proteins that you need to clot your blood. It's responsible for metabolizing out all the bilirubin in your body. So patients who have liver damage will see that they get melena, which is frank blood in the stool. We'll get hemorrhagic gastroenteritis, so that's, again, more blood. Melena is digested blood, so this is that black, tarry blood. Hemorrhagic gastroenteritis would be frank blood, either in the stool or the vomitus. We'll get bruising. Our ecchymosis, we said, is the fancy word for that. Petechiation. And coagulopathy just means lack of blood clotting because we're lacking these clotting proteins. On top of that, the liver won't be able to do its other jobs, like getting rid of bilirubin, so we might get our icterus or our jaundice, that yellow coloration, and eventually, you do need your liver to live, you will die. So the death rate is about 30% for this. If we can, of course, induce vomiting to get rid of the sago palm, that's a great idea. We can start our liver protectants like denamarin or SAM-E, and charcoal may or may not be effective, but we can try to give that too, and that'll reduce the death rate, but it's still a very dangerous plant. 2 more environmental toxins here. Ethylene glycol is antifreeze, and not every formulation of antifreeze is ethylene glycol, so it's worth checking on that. Some are not toxic, especially because this is also a big problem with children. So pediatric emergency physicians have also tried to get rid of ethylene glycol use because of this. It has a sweet taste, which is why kids drink it. For the most part, that's not what we see. We see that cats are going to be, underneath a car hiding outside, and someone's car is leaking antifreeze. They walk through it and then they lick it off their paws. So dogs can be affected, but usually it's just cats coming in contact with it in the environment. The signs would be exactly the same though. What we see is that the ethylene glycol forms toxic metabolites, so basically different chemicals from its initial structure, and these cause acidosis, so they cause a lowering of our blood pH. And they also cause damage to the kidneys. So this is primarily going to affect the kidneys. So that's not good. We don't like that. Sad kidneys. It's important for us to know that there are stages to ethylene glycol toxicity, and if we can recognize this earlier in the stages, the patient is more likely to survive. So I want my patient to live, therefore I want to know the stages. So in the first 12 hours, we'll see ataxia and stupor. Okay, so stupor would be I'm kind of out of it, I'm confused. Unfortunately, this usually just means I'm a cat, I go hide in the closet and you don't see me for 12 hours, which is not necessarily something you would notice, or at least I wouldn't with my cats. 24 to 48 hours, you can see GI signs, so inappetence, vomiting, diarrhea. Unfortunately, we don't usually get the patients in the hospital until we get to that 48 to 72 hour mark, and this is the point at which the toxic metabolite has already formed and we get damage to the kidneys. It's important to know that not until this point will we see those calcium oxalate monohydrate crystals in the urine. Learned about those in other classes. They kind of look like this. They can be all different sizes. Okay, that's different from our dihydrates. Our dihydrates would be these guys. Okay, calcium oxalate monohydrate will be present, but if they catch this early, we will not see those until the renal failure has taken place. So that means that just because we don't have these doesn't mean it's not ethylene glycol. So please keep that in your brain. So the only good part about this is there are some specific antidotes out there if we identify that ethylene glycol is the toxin. So there's a drug called 4-methylpyrazole or 4-MP or fomepizole that will prevent the ethylene glycol from turning into the toxic substance that harms the kidneys. Okay, so that's out there. The other thing we can do is give IV ethanol, and I know this sounds crazy, but the closest thing we have to it is usually really high proof cheap vodka. So if you've ever seen that in your clinic, that's why. We can give this IV and this will actually counteract the effects. However, of course, we have to be careful not to give too much or the pet will be very drunk, and too much alcohol, of course, can shut down your cardiovascular system, stop breathing, that kind of thing. So we give enough that we hope the pet is still responsive, and that would be our job to monitor. Now, we may also need to give drugs to help with the acidic blood. Bicarbonate is what we call a buffer, and a buffer is something that helps you control pH. And your body makes bicarbonate, but if your blood has become very acid because of a toxin you've ingested, we may also have to give this drug to help you out. Now, the main thing is definitely going to be treating the kidneys and protecting the kidneys. So that's going to be, again, diuresis, high rates of IV fluids, to make sure that the kidneys get good perfusion and that we move the toxin through quickly and minimize the chance it has to do harm. So these cats are usually in the hospital for 2 to 3 days with diuresis and possibly these other treatments, and then we just have to hope the kidneys recover enough for them to be able to live a normal life. Zinc is metal, of course, that's in some pennies, but more often we see issues with zinc in cheap jewelry. If you've ever ordered jewelry from wish.com, and I totally have, a lot of that stuff is zinc based. In this case, the pets ingested, these are fishing weights of zinc. And a lot of the time the ingestion itself is these small objects that doesn't cause them any distress, but if it sits in there long enough, the zinc starts to get into their bloodstream and it will damage the membranes of their red blood cells. So what we see with zinc ingestion is over time anemia, okay, a decrease in red blood cells. And sometimes because it's something they've ingested and also because they just don't feel good, not having enough blood, we'll see that they're kind of depressed and have some vomiting and diarrhea and are not eating so well. So first, we need to identify what the problem is. And that's why x-rays are a nice option. Anytime we have a pet that's sick of any kind, we do blood work and x-rays. And you may be saying, why for an anemic patient do we need x-rays? Well, you can be anemic because you have a tumor, or you can be anemic because you've ingested something like zinc. And zinc, fortunately for us, is very radio opaque and shows up very well. So if we see this, we can go in and remove it, and that might be enough. Now, if we need to, we can give blood products to treat the anemia. We're going to have a whole class where we talk about that, or other supportive care like fluids if they're having vomiting. There's also chemicals out there they call chelation chemicals that help remove zinc from the system permanently if there's a lot that's been built up. This is not something we usually do for our small animal companion animals. They don't usually have enough zinc for it to be an issue, but if you talk to like Liberty Wildlife, there are bird rescue here in Arizona. They have issues with birds eating buckshot that contains lead or zinc. And they use chelation therapies because the metals build up a long time in the bird's system, and that will help remove it. So with them, it's not just removing the source, but all the buildup over time. That's not really an issue with our patients. Grapes and raisins are human food that are toxic in any quantity to both dogs and cats. Currants fall into this family too. I don't believe that cranberries do, but different plants that are related to grapes and raisins can, so it's best to err on the side of caution here. How this happens or how these substances cause harm is not known. That's what's meant by etiology, that's cause. Or how it happens, we don't know. And what's crazy about this is most of the toxins that we've talked about are dose dependent. If you get more ethylene glycol, you are going to be sicker than if you get less. If you take too much baclofen, you're going to have a worse reaction than if you take less baclofen. But grapes and raisins don't seem to be dose dependent, or at least we haven't identified the factors that are important. So I can be a Great Dane and get one grape and go into kidney failure, and I can be a Chihuahua and eat a bag of grapes and be fine. It doesn't depend on how many I get, which is what makes this a little scary. So if we have a pet that we know has eaten grapes or raisins, we always recommend bringing them in right away to induce vomiting. If we can get them out of the system, that's the best case scenario. We give charcoal as a precaution, and then if we can, we would keep them in the hospital on fluid diuresis and monitor those kidney values for the best possible result. A lot of the time clients can't afford this, or they feel like if you've had them, vomit out all the grapes, they don't need to do this. And, that's their choice. But in those cases, we recommend coming back every 24 hours or so to check those kidney values. And if they do start to show signs of damage, then we can admit the patient at that point. Chocolate is a toxin we're all pretty familiar with. The type of chocolate is going to dictate how severe this is. And if you look online, you can just search chocolate toxicity calculator. There's lots of cool little calculators out there where you can put in the weight of the patient and the type of chocolate, and it'll tell us how likely we are to have a problem or which signs we're going to see. So with milk chocolate, right, or chocolate cookies or cakes, those signs are going to be less severe than if we had dark chocolate or cocoa powder, very concentrated chocolate. And there's a few substances in chocolate that we're really concerned with. The first is just caffeine. Caffeine, of course, is an upper, so we see signs like hyperactivity or tachycardia or high blood pressure at really high doses, okay? Arrhythmias, seizures, death. Imagine, taking a bunch of meth kind of a thing. That's how I think of an upper. We also see theobromine as an active compound in chocolate, and this is also an upper, so same kind of situation here. Now, in mild cases of ingestion, we may just have GI signs, but again, the more we get, the more likely we are to see these more severe signs. So a patient that already is showing these signs, I'm more concerned with than a patient that, oh yeah, maybe he just vomited, or I know he ate chocolate. If he's already got a high heart rate, or they're reporting that he's hyperactive, most likely he's already gotten some into his bloodstream, and we're going to treat him more aggressively. Decontamination, always the mainstay, so that usually means inducing vomiting. This is a good idea even if the pet has been vomiting at home, because the type of vomiting we see with our emetics is much more violent, and I can't tell you how many times they say they've been vomiting at home and we give the emetic and they still vomit a very large amount of chocolate. Charcoal is helpful in this situation, and if we're already showing signs, we might want to admit them for IV fluids. If not, we may just give some sub-Q fluids. And because chocolate is pretty fatty and not something they usually eat, sometimes it's nice to give them antiemetics and also other, anti-diarrheal medications that'll help just soothe the GI tract. You absolutely can die from chocolate toxicity, and the smaller you are, the more you get, the more likely that is to happen. Xylitol is in a lot of sugar-free gum. I know there have been panics about it being in peanut butter. That's a pretty hard product to find and pretty expensive, but I suppose that's out there too. Not every sugar-free gum has xylitol though, so this is a good time to call poison control if the package is not clearly labeled, so you don't have to treat a pet if they don't need it. Now the main issue with xylitol is that the body thinks it's sugar, so when the pet eats the xylitol, the body releases insulin, and that's going to drive the glucose down. Now that'd be fine if the pet had actually eaten sugar, but because it's not real glucose and the insulin sends glucose into the cells, now we have a pet that's hypoglycemic. And with hypoglycemic, we said last week we can see seizures and death. Xylitol can also damage the liver in the long term, so that's a concern as well. So of course, decontamination, it's fun to induce vomiting for these guys because the vomit's always really minty. Keep in mind they probably ate the package too, so you do want to look out for that. We'll give sugar, IV, over a period of a day or two to help maintain that blood sugar. And then our medications like our SAMe or Denamarin to help with the liver function. Allium species, this is our onions and garlic, when eaten in large quantities can be harmful to both cats and dogs. And I took a phone call once from a guy who got those animal style fries from In-N-Out, and his cat had eaten a couple little pieces of the onion that was stuck to the cheese in the little container left over. That's not what we're talking about here. They have to eat a pretty large amount, and it's rare that we see this unless they've been given a product like one of those over-the-counter pet vitamins that contains onion or garlic. What we see with that onion or garlic is that it can interfere with the formation of normal hemoglobin, and hemoglobin is the part of the red blood cell that carries oxygen. So we'll see that instead of regular hemoglobin, they form this sulfahemoglobin, and then their blood cells are not effective at carrying oxygen. Well, what does that look like? I look pale, okay, and I look like maybe I'm not breathing super well over time. So if we know they've eaten a large quantity of something containing onion or garlic, we can induce vomiting, we can give charcoal. Fluids are never a bad idea if we're dehydrated, but the main thing here is I'm going to need oxygen for my anemia and probably a blood transfusion to replace that bad hemoglobin with good red blood cells. This is mainly just an issue with cats. Dogs can eat a ton before this becomes a problem for them. Ethanol. So ethanol is alcohol. I mentioned that we do sometimes give this on purpose to counteract our ethylene glycol toxicities, but everybody knows alcohol poisoning. In high doses, we see central nervous system depression, cardiac and respiratory depression, certainly incontinence and low temperature. A lot of the cases I've seen, people have intentionally given it to their dog. The first one I ever saw was a Chihuahua who every night the woman would have a screwdriver, vodka and orange juice, and she said she would take a drink and the dog would take a lick, and that was their normal routine every day. But on this particular occasion, I guess the dog drank more than it usually did, and it was a small dog, so it was ataxic. It was, leaking urine, incontinent, and cold. And she was concerned. So the treatment's supportive. We can give IV fluids to help metabolize the alcohol faster. Of course, we could give cardiac or respiratory stimulants if we need to. I've never seen a case where that has happened, but we want to make sure that the heart's beating okay and the blood pressure's okay, and of course that they're not unconscious. So we'll keep them in the hospital and monitor, basically let them sleep it off. There's a million different vitamin supplements out there, so if you do have a pet that's gotten into a vitamin supplement, you want to call poison control. Sometimes there are ingredients there that are toxic that are not on the label, and poison control will have those. A dog that just eats a bunch of a multivitamin probably will just have vomiting and diarrhea, just have GI signs. But let's say they eat something that is like a pre-workout supplement that contains caffeine, then I'm worried about those upper effects, so hyperactivity, high blood pressure, cardiac arrhythmia. So it's best to err on the side of caution. If we know they've eaten a ton of something, usually we'll induce vomiting, decontaminate as a precaution, and again, consult poison control just to double check. Lastly, we're going to talk about some actual drugs that the pet may get into. We've kind of been skirting around those. Marijuana is super common. Dogs love it. They'll seek it out and ingest it. How severe the signs will be depends on the THC content. So THC is the psychoactive component of marijuana, and we see that the prescription forms tend to be stronger than what we see, bought on the street. So it's definitely become more of an issue as marijuana has become more legal, more available. The signs that we see, you definitely want to know these: bradycardia, so low heart rate, tremors, not seizures, but kind of shaking, ataxia, lethargy, and leaking urine, urinary incontinence. So this is a big one for sure. So a lot of the time people come in and they just say, hey, my dog looks kind of sedate, he's falling over, and you may have to get out of them whether or not he's been exposed to marijuana. So I'll usually say, is it possible it's in the house somewhere, or your roommate had it, or he picked it up on a walk here. Another real common sign we see is what they call hyperesthesia, which is kind of a delayed sensitivity reaction. So you go and you move towards the patient's face, you do that menace action, and there's a delay, and then they jump back in a very exaggerated fashion. So they're very hypersensitive to that handling. It's notable here that even though the pet has bradycardia, there's no low blood pressure. So we see we have a normal blood pressure, okay, and no cardiac arrhythmias. So there's actually never been a case of marijuana ingestion in a dog where the pet died as a result, unless it was mixed with chocolate or some other drug. So you do want to double check about that. But we can check these patients' blood pressures. They should be normal. Now, usually this is just a matter of a few hours that the pet is affected, but it can be days depending on the dose. And so if we have pets that are really lethargic because they've gotten a high dose, sometimes we have kept those guys in the hospital. Otherwise, probably not necessary. Now, as far as treatment goes, we don't generally induce vomiting because marijuana itself has antiemetic properties. Plus, if they're a little bit sedate or lethargic, we don't want them to aspirate on their vomitus. Sometimes we do administer activated charcoal. As I mentioned, it doesn't seem to be real effective. We'll usually give some sub-Q fluids at least to help them maybe metabolize it out a little faster. And if they're recumbent in the hospital, if they're really lethargic and sedate, we may place a urinary catheter. But for the most part, we don't do a whole lot. We just send them home and we should see the patient gradually recover. Acetaminophen is Tylenol, and we do sometimes give this intentionally to dogs. They can tolerate it somewhat. It's used for pain, but it's extremely toxic to kitty cats. And this is kind of similar to onions. We said that onions will cause them to form a sulfahemoglobin, a weird kind of hemoglobin that doesn't carry oxygen. And we see the same thing here. We form something in cats called methemoglobinemia, which causes the hemoglobin not to be able to hold on to oxygen, and also the body to destroy those red blood cells. So we'll see signs of anemia, including difficulty breathing if we have few enough red blood cells, paleness, weakness, lethargy. Another thing, and it's really hard to tell from this picture, but that you should associate with acetaminophen toxicity is chocolate brown mucous membranes. And that's the discoloration is because of this weird form of hemoglobin. Now, with this, if we know that they've been given a dose, we can induce vomiting. Most of the time when I've seen this, the client has given a dose over a period of days, and probably decontamination isn't going to be helpful. So we'll admit them to the hospital, we'll put them on fluids, they may need liver protectant drugs, and we may also need to give a blood transfusion to replace those bad blood cells. As I mentioned, there's another antidote for this called acetylcysteine. That's a drug we can give by injection as well, and that can also block some of the acetaminophen from having an effect if it's been given recently. Now, NSAIDs. NSAIDs are drugs like ibuprofen, okay, drugs like Rimadyl. Sometimes we see an overdose here because the client's given too much of one of these over-the-counter drugs that they're not supposed to have. Sometimes it's the dog got the ibuprofen or the aspirin out of the purse. Sometimes those Rimadyls are chewable and super tasty, so they eat the whole bottle. But this is a situation where the dose is really important because we're going to see different effects depending on how much they got. So remember I mentioned trying to figure out how many pills are left. You want to do that here. At low doses, we may just see GI signs or possibly ulcers, and we can do things like just send home GI medications to help protect the stomach and protect against vomiting and diarrhea. Higher doses, we're going to see renal failure, so then we're going to need diuresis, right? And at really high doses, we can see coma and seizures, and I've definitely seen this happen. And at that point, at either one of these levels, we definitely need to be admitted to the hospital. So keep in mind decontamination always first, and then after that, our treatment's going to depend on the dose. Now, amphetamines. Amphetamines, of course, includes drugs like meth, but I'll tell you the one I actually see the most commonly is Adderall. Adderall is a drug that people use to study. It's used to treat ADD. It seems like everybody in the world has Adderall in their house. I actually think it's just one L. But it is something that unfortunately is super common, and if pets get into it, it's an upper. All amphetamines are uppers. So hyperactivity, okay, hyperthermia, usually from the hyperactivity or running around in the yard in a circle. We can get ataxia, And it's not on the list here, but we can get also cardiac arrhythmias, right? Any upper that increases my heart rate and makes my blood pressure go up and all that kind of stuff, okay, is going to potentially cause issues with my heart. Pupil dilation, we see that too, and sometimes even tremors. So if we know the pet's gotten into an amphetamine, we need to do things to sedate them, essentially, to block the effects of the upper. So phenothiazine are tranquilizer drugs like acepromazine. It's going to have the opposite effect. It's going to slow the heart rate, it's going to be sedating, it's going to lower the blood pressure. The other thing we can do is drugs called beta blockers. And normally the upper drugs will bind to beta receptors that affect the heart and lungs. And if we block these receptors, again, we're going to have the effect of decreasing heart rate and decreasing blood pressure. So we can use one or both of those types of treatments depending on how severe things are, and then probably fluids to help flush things out, and we just wait for stuff to wear off. Now, pyrethrins are in many, especially over-the-counter flea and tick products. These are very toxic to cats, but we can also see certain dogs are sensitive to them, just like certain dogs can be sensitive to ivermectin. Usually this is put on topically, and then we'll see shortly after we get hypersalivation and tremors. Tremors are different from seizures. Tremors is all over body shaking and sometimes rigidity, but seizure, I've lost consciousness. So tremors, I'm still conscious, but we can see one or both with these. Usually it's just severe tremors. A lot of the time we start to have dyspnea, difficulty breathing, because we are salivating so much and we aspirate some of that salivation, so it's not good. I've included some videos in your playlist of what this looks like, but the first priority is always going to be to get it off of the patient. It's put on between the shoulder blades, so use soap, water, wash it off, and boy, that's real fun when they're having a seizure, I'll tell you. And then we'll give other medications to stop the tremors or seizures, like our anti-seizure drugs, Valium. Usually that's all they need. All right, lastly, we've got our rat poison or gopher bait. There are a few different kinds out there, but the main type that we're familiar with causes hypocoagulation, meaning we can't clot our blood. If the patient ingests this, we want to, of course, induce emesis right away. And what's nice about this rat poison or gopher bait is that they give it this green, blue, turquoise colored dye, so we'll be able to see in the vomitus pretty readily if there's any in there. After we do that, if we suspect it's the type that involves hypocoagulation, we're going to give vitamin K. But this rat poison, what it does is it interferes with the synthesis of vitamin K, and vitamin K is needed to clot your blood. And so if you're a rat, you bleed to death because you don't have enough of this in your system. Well, what we can do is we can give an injection of vitamin K, and then we can also send the patient with oral vitamin K pills to go home with for a few days or a few weeks. It kind of depends on the doctor. And this will prevent that hypocoagulation from occurring. Now, there's another type out there that involves the central nervous system and affects the brain, and that we don't have an antidote for. So with that one, inducing emesis as decontamination is our best bet. Fortunately, I actually haven't seen that happen in practice yet where they've gotten sick from it afterward, but that's a good thing because there is no specific treatment for that type. So usually we induce emesis, we give vitamin K, and we hope that it was the type that that therapy will be effective for.